Health and Social Welfare, Adekunle Salako, urged Nigerian health professionals to resist the temptation of migrating abroad in search of better working conditions, emphasizing the federal government's commitment to collaborating with healthcare workforce to address the rising prevalence of cardiovascular diseases in Nigeria. Salako made the appeal at the 8th annual Abuja Cardiovascular Symposium organized by CardoCare Multi-Specialty Hospital. The event, termed Sudden Cardiac Death, brought together over 800 healthcare professionals to discuss solutions for the issue. It focused on life-saving interventions such as ECG interpretation, basic life support BLC, and advanced cardiovascular life support ACLS. Salako, representing the coordinating Minister of Health, Professor Ali Pate, also praised CardoCare Hospital Abuja and Iseko of Limi Hospital Group for their role in reducing medical tourism and improving healthcare delivery in Nigeria. Professor Augustine Odili, president of the Nigerian Cardiac Society, delivered the keynote address advocating for the inclusion of BLS skills in education to improve sudden death management. Iseko highlighted the symposium's impact on reducing Nigeria's dependence on medical tourism and imploring health care outcomes, noting that CardoCare Multi-Specialty Hospital is leading efforts in advanced cardiovascular care and postgraduate education for healthcare workers. Over the last few years, we've had a brain drain problem in Nigeria for medical professionals, healthcare workers, nurses, doctors. Everybody is trying to Japa. What do you think the Nigerian government, as earlier said in the news, can do to make people want to stay and serve the nation?
Actually, this story is quite a funny one. Because the brain drain, as far as I'm concerned, is going to continue.
Why? Why will it continue?
Yeah.
I want to ask you something else, but I want you to tell me why it's not going to continue. Because why is it going to continue? Because if you're going to leave Nigeria, why school in Nigeria? You school in a place because you want to serve. The education for nurses, for medical professionals, is cheaper here in Nigeria than many other places in the world. Now, if you know that you're just going to abscond with all of that knowledge, why learn here?
Because I paid for it.
Why don't you go to the country? Why don't they go to the countries they want to abscond to learn it there?
It's typical of every human nature. For instance, if you want to toe in that line, goods are imported all over the world. We import goods from China, we import goods from America, from Germany. Why don't they sell it there? You go to where you make your profit. So that's just the thing. You know why I said that the story is funny?
Why?
The government knows what to do. Anybody, no matter the area, not just on the health sector, no matter the sector, anybody trying to tell the government what to do or saying that the government doesn't know what to do is a joker. The government knows what to do.
Why do you think they're not doing it, what it is they're supposed to do?
Now, the one thing you should know about, if I should call it the rich, I mean
men of echelon, higher powers.
Beautiful. They know that the success to staying rich is to keep the poor poor. Sadly, that's the case with Nigeria. If an average person, why do you think America to a large extent practice true democracy? Not 100%, but to a large extent. Because the average American is okay. He has a voice. The poor doesn't have a voice. So if out of 200 million people, you have more than 100 million below the poverty line, the rich controls them and they stay there. And they will never try to make things improve to bring those people up there, because they know that once those people are up there, they'll be challenged.
So why do you think they'll be challenged if that is not the status quo in America? And other countries that have, the poor over rich equation well balanced?
Because, like everyone knows, just like I said, America may not be perfect, but at least they're on a good trajectory. The political class, not just political class, the leaders in every strata want the best. They want quality. In the West, you are respected for impact. Here, yeah, a lot of people strive for impact. Of course, corporate organizations strive for impact, knowing fully well that people tend to patronize you because of quality. Unfortunately, our political class doesn't have that ideology. That's one of our challenges. Then back to the story. Why I said the brain drain syndrome is not going to end.
Stop, yeah.
Yes, is for the 7 years, if I'm correct, for medical students, generally health workers, 4 to 5 years. An average health student, whether medicine, nursing, whatever. Let me start with medicine. An average medical student doesn't spend, even in the least public school, will not spend anything less than 20 million graduating. I can't sink that money. And I want to practice in a country that doesn't give a hoot about me. I can't sink that money. Are you aware that medical doctors are being kidnapped in Nigeria?
Sadly.
There's no security.
But every other person is facing, many people of different occupations face a similar fate, because that's a problem on ground that the Nigerian government is meant to fix with the case of security. It's not limited to medical doctors, as it were.
I totally agree. But now I have what other people need. They say, use what you have to get what you want.
Who said that?
They say. So, I'm a professional, a medical professional, so I use what I have to have what... Brain drain is going to stop when Nigerian government do the needful. What stops the Nigerian government? When I mean Nigerian government, I mean local government, I mean state government, and I mean the federal government. The local there is no local government in Nigeria that cannot fund a standard hospital. Let every local government fund one standard hospital. Let every state government fund 2 standard hospitals. And let the federal government of course cannot fund a standard hospital per state. It will be, they have the money, but let's say it might be humongous for them. But let them fund a standard hospital per geopolitical zone. Doctors will stay because there are more opportunities. These guys won't stay because there are less opportunities for them. It is less beneficial for them to stay.
But we have a lot of people in Nigeria that need medical attention.
It's just like saying we have a lot of poor people. Therefore, a businessman that is selling rice, do you know that a cup of rice is as much as 600 naira? Now, will you now say because there is a lot of poor people, oh, the businessman should have compassion. I buy a bag of rice at probably 90,000 naira, meaning that I'm going to sell 1 cup at 500 naira, but because I want to have compassion, I should be selling at 200 naira. No. That's the same thing with these medical doctors. It's not about compassion. If they don't have what they need to do what they want to do, they will go to where they have what they need to do what they want to do. Most of them, it's not all of them, I can assure you that a great number of them are not jackpying because of greener pastures. No.
So why are they leaving?
A lot of them are leaving because they want to be better. Now, from the story we heard, there are machines that... How many hospitals can afford that? Now, after studying medicine, do you know that a lot of doctors have not handled those machines?
Now, I want to ask you something, right? Do you think that these private clinics play a role in making the government not to focus on medical personnel more? What I mean is, a medical personnel is working in the government, and for most of the civilized countries abroad, they usually have only public-owned clinics. They don't have private hospitals as such. Now, do you think the advent of public clinics has made the government lose...
You mean private clinics?
Private clinics has made the government lose, its total interest as regards to welfare and impact for medical practicing people?
Okay, I think in this case, I will have to take the blame away from the federal government. Because we notice that most things that are obtainable is some of these private clinics are owned by doctors working in the working in federal medical centers, federal government-owned hospitals. And we have seen a lot of scenarios where you have a case and they will refer you from that hospital to their own private hospital.
Right.
Yeah. Now, the result of that, or the effect of that, is that there is a machine that is needed in that hospital to treat you, and the hospital doesn't have that machine, but their own private hospitals have those machines, and you are referred. They will fail to do what it takes to ensure that federal government supplies these machines in those federal hospitals, because the moment federal government supplies those machines, then they will start benefiting.
Right.
So yes, it has a big role to play.
So what can the government do to secure brain drain? Because many Nigerians fall ill. We've had lots of things as regards to flood. Lassa fever is quite high in recent times. So many other things are going to come in the few years because nobody plans an outbreak, it just comes. How does the government make medical personnel stay and work for the nation under the oaths which they took to serve the people?
Okay, beautiful. I'll ask you this question, then I'll share my thoughts. Have you ever seen a headline or heard a story? The president, the governor, the local government chairman, the minister, the commissioner discharged today after spending 2 days in the hospital. The question is, don't they fall sick? So where do they go? Is it that they are treated at home, or they fly abroad?
It's also a possibility that some of them patronize private hospitals, as we rightly said.
Okay, beautiful. Let's assume that's the case. But again, we have seen these political leaders fly abroad for medical treatment. Not just them, family members also. As long as... Now, when you want... We are practicing democracy, right?
Yes, we are.
You can't tell me I have an oath. I shouldn't go abroad to practice. But when you are sick, you won't come to that same hospital that you want me to practice. You go abroad for your treatment. The oath should be binding on you too. You come to that hospital, let me treat you. When our political class, when they will use our hospital, is when our hospitals will get attention.
Thank you so much.